Jesus, yeah, you have done it again. Jesus, yeah, in your special way, what was impossible, you made possible. Jesus, yeah. Hello, my peeps, how are you? I hope you're doing well. Yes, so thank you for your love and support so far. For the videos that I've been doing on understanding cervical cancer and also HPV as one of the risk factors for cervical cancer. So in today's video, we're gonna deep dive into the discussion about the symptoms for both cervical cancer or HPV, if there are any actually. But before we get into the symptoms, I thought it would be good to highlight that the reason why this is a major disease that even has a global focus is that so many women are dying from cervical cancer. And actually in Kenya, 10 women die every day from cervical cancer. That's quite a high number. And then in the global aspect of it, every 2 minutes, a woman dies from cervical cancer. So that's it. That's the reason why it's such a disease of public health significance, and we need to act on it and make sure that we do all we can to prevent this death from happening. What are the symptoms, first of all, for HPV? Because you've been talking about HPV. And sorry to burst your bubble, first of all, HPV does not have any signs and symptoms at all. Since it's such a common virus, actually, most of the people might have it at some point in their life. And if your immunity is good enough, your body will clear it and you will not get cervical cancer. But there are other HPV viruses that are quite persistent, and those are the ones that cause cervical cancer. So there are no really symptoms in terms of a tear discharge or something like that. No, you'll not actually know at all whether you have HPV. I could actually be sitting here and talking to you and maybe I have it, or you could be out there living your life, but you don't know. And for you to actually know that you have the disease, you need to do the screening, which I'm going to talk about in another video. In case you already have the disease, because by the time someone is presenting with the signs and symptoms of cervical cancer, it means that it's already at a late stage. Not to mean that nothing can be done really, but it means that the options might be quite limited. But what are some of the obvious signs for cervical cancer? One of them is pain during or after sex. The other one is vaginal bleeding, and this could be in between your menses or after menopause. Back pains, that is the lower back most of the time, or abdominal pains. The other sign or symptoms is actually having a discharge, and this is a foul smelling discharge with bad odor, that is. So these are some of the clear signs and symptoms of cervical cancer. But then again, for you to be able to establish that you have cervical cancer, there needs to be a way of establishing what is happening in your body. So one of them that I talked about is, of course, HPV test, which is going to be checking for the high risk types of HPV that cause cervical cancer. And the other testing methods include VIA, that is visual inspection with acetic acid, whereby they're going to open your cervix or your vagina and get to the cervix, and then they apply acetic acid. So the outcome, or basically the changes in the cervix, are going to tell your doctor what is happening in your cervix. The other one, of course, I'm sure maybe you've heard about it, is about the pap smear. And pap smear, basically what it checks is the cells in the cervix. So they have to do a swab and it's taken to the lab. Once it gets into the lab, they are going to observe it under microscope, and then they are going to tell you whether it's cancerous or it's not cancerous. Yeah, so those are some of the available methods for screening. Yeah, but before we get to there, we want you to be able to live a healthy life, not to get to a point whereby you're already having the symptoms. and which means it's already a little bit late. So before we get to there, we need to be aware about these things, about the risk factors, which I talked about earlier in my previous video. Make sure that you check it out. So I know for sure this is an heavy kind of a topic, and some of the people watching me might actually be going through this journey. It's a heavy journey for sure. It's not an easy one at all. As I mentioned earlier, I actually lost my own mother to cervical cancer. And to be sincere, I could see the pain that she was going through with not knowing what next, really. And unfortunately, we lost her. So this is just to bring out the message of hope. By the time my mother was being diagnosed with cervical cancer, that was in 2011. At that point, there were no actually organized screening programs. So fortunately, right now there's hope, since there are more screening methods and more organized way of screening that women can get help from. So this is just a message of hope to someone who might be going through the journey, someone who has lost a loved one from the disease, or someone who is a caregiver who is helping someone who is going through the journey of recovery. We are with you. There are a lot of communities actually that are able to help you. In case you need to be connected to one of these communities, feel free to comment. Text me if you have my number, that is, on my DMs, on my Instagram or Facebook. Let me know if you need assistance. So that's it for today. Thank you so much for tuning in. I'm going to see you on the next video, whereby we're going to be discussing more and more about screening. What is screening, first of all? I'm sure I mentioned some of the screening methods, but really we need to know what is screening, what are we doing, what are we checking. Yeah, so be tuned, and thank you for the love, thank you for your support, and see you on the next video. Bye bye.